Welcome to the show, David Wills, the Director of the Nurses Society of New Zealand. David, thank you so much for giving us a few minutes tonight.
Hi, Kiora. You're welcome.
Hey, listen, there is this conversation going around in the media at the moment about there being a crisis in the healthcare system. Now, I think there may be a conversation to be had about the healthcare system in general, but one of the particular and specific areas that the media is throwing backwards and forwards is there's all of these nurses sitting on the sidelines who haven't been vaccinated, who want to come back to work, and that's contributing to the crisis. And I saw a tweet put out by Stuff last night, let me just bring that up, that said hundreds of unvaccinated nurses across New Zealand want to return to the workforce to help with the health system in crisis, but the government continues to deny them. The Nurses Society of New Zealand replied to that tweet, the reality is that unvaccinated nurses are not wanted back in the health service. They are a small minority with views inconsistent with their professional obligations. Now, first of all, tell us what the Nurses Society of New Zealand is, so we know who you guys are.
Well, we're the second largest nursing body in the country, representing. We have more than 7,000 members across all parts of the health service. That is registered nurses. We are also a registered union, or we have a registered union arm. So we're also the second largest nursing union in the country. But we say second largest because there is another one, obviously, that some people are familiar with. And indeed, there are a number of other bodies around as well. But we have a significant membership, as I say, across all parts of the health service, and have for some years, decades, in fact.
So talk to me about this. I guess it's not officially a statement, is it? I mean, what is Twitter these days? It's sort of the marketplace, the place where we go and give our ideas. It's quite a I don't mean pointed and like, you know, when you hear that phrase pointed, you kind of sometimes think, well, that's a bit nasty, but it's quite a direct message you're putting out there that the community within the health sector doesn't want these nurses back. Explain that to me and expand on that if you would.
Well, first of all, the numbers that are not vaccinated are very, very small.
Like what, how much?
Well, I can't give you a specific number, obviously, but even if we talk about the lobby group that is seeking and campaigning in this area, they claim that they have variously reported 600 to 700 members, of which many of them clearly are not practicing nurses, because a few have emailed us and we see they haven't got practicing certificates. And then additionally, many of those are healthcare assistants. I'm not saying healthcare assistants are not important, because they do provide support to nurses. But the numbers, given the total nursing workforce, the total number of registered nurses, we have 60,000 registered nurses in New Zealand. Yeah. So even, the numbers that haven't been vaccinated are relatively insignificant. Full stop. I mean, that's a fact. Most nurses recognise the importance of being vaccinated. They also have a professional duty to be vaccinated. They are under an obligation to protect patients and to protect their colleagues. It really comes down to simple as that. And also they have a duty to practice evidence-based nursing. That contemporary nursing means that all the steps, the measures, everything that a nurse does is evidence-based. And obviously, nurses who are not vaccinated, who are in the COVID denier category, aren't following those commitments.
Is that what, I mean, obviously you can't speak for 100% of these nurses, but is that basically what's all meaning the massive majority of these nurses have bought into sort of the conspiracy theories in your experience around COVID and COVID vaccines?
In our experience, the ones that have contacted us, and obviously very early on, we had a small number of members, very small number, who weren't vaccinated. They did cite all sorts of misinformation and such like. They've got a duty as trained health professionals to get sources of information from proper medical sources, to be guided by all the expert authorities and such like, not like Google something and someone told me this and all sorts of the crazy things and so forth. And, a few of the people that we've spoke to who fall into that anti-vax category had very bizarre ideas and just not consistent with nursing. Early on, we canvassed our members, and we can say that early on, even before there was the mandate, nurses were getting vaccinated. And even if the legal mandate were to go, even if it was no longer required under the health regulations, in most workplaces, there would still be a requirement for nurses to be vaccinated because of health and safety considerations. They have a duty of care. They have a duty not to expose patients, not to expose colleagues to risk. And being vaccinated is one of the ways of mitigating risk. It's not the only way. It's not 100% infallible. No vaccine is. Obviously, the COVID vaccines actually are much more effective and are safer than most vaccines. They're safer than the flu vaccine. They're more effective than the flu vaccine in actual fact. But it's partly about protecting patients. It's partly about judgment. It's partly about professional responsibilities. The regulator for nursing in New Zealand is the Nursing Council of New Zealand. Early on, they issued guidelines pointing out the importance of nurses to be vaccinated, to protect patients, the importance of nurses promoting vaccination as health professionals. That's the recognised position of the vast majority of nurses. And frankly, we don't want nurses who chose not to be vaccinated back in most parts of the health service. You don't want them in patient-facing roles, putting patients at risk and putting their colleagues at risk. Now, there's a small number of people.
Yep.
Sorry, there's a small number of people who have genuine health reasons who have been able to get proper exemptions. They can get an exemption if they get a certificate from a registered medical practitioner or a nurse practitioner, and then that is signed off and approved by the Ministry of Health. So we have a small number of people that fall into that category, and then they can continue to practice, taking other measures and not being a patient-facing role. So that small number can be accommodated. But the person that falls into the anti-vax category that we're talking about here, they're not, they can't get medical exemptions because there's no basis for them to get such an exemption.
You've cited 600 to 700 based on the lobby group. Let's just call it 600, being generous to them, even if that was the case, that's 0.01% of the current nursing population. In your opinion, let's say that we got overnight another 600 nurses into our system. Would that basically stop what everyone's describing as the crisis?
No,
would those numbers actually make a difference?
No, we've got a crisis partly because of an underlying long-standing shortage which has occurred over a long period of time. But much of the current crisis is, of course, obviously due to the health services problems arising from COVID, arising from influenza, and the large number of cases of RSV. Our health system, no health system in the world has been able to cope. Even the best health systems in the world, and even with our shortcomings, we've got a strong system compared to many countries. But even with the best systems in the world, haven't been able to cope once you get flooded with COVID cases. They take up beds, they're taking up resources, they're hitting primary healthcare services, and of course, staff go down sick as well. Yeah. And so with staff off sick, patients coming in occupying beds because they've got COVID, and patients coming in because they've got flu, and their flu may be worsened because they've had a previous damage to their system from having COVID. The system can't cope.
Yeah.
And that small number coming back would not make a difference, and that expose everyone to risk. They're more likely to get COVID themselves, spread COVID themselves, even if they were tested. Tests are not 100%. They put people at risk. And no reasonable person really thinking about it would look and say, yeah, I don't mind being cared for by a nurse who's not vaccinated. Oh, I might be vulnerable or something like that, but I'll take that risk. No way. They're better outside the health system if they choose not to be vaccinated.
Two more very quick things. And the first is really just a confirmation, because you've basically already said it, but just to be unequivocally clear, At the moment, nurses need to have a series of vaccinations to practice, don't they? Forget COVID, but up until before that, there are vaccinations that they must have to get a practicing
Yes,
certificate.
depending on settings and all sorts of circumstances, in the same way when some people are going overseas and so forth. It used to be more widespread. In other words, if you go back decades, obviously every nurse had to be vaccinated against things like smallpox and polio and so forth. We don't have polio because it was eliminated by vaccination. But talk to some elderly nurse and you will know all about that. And then there are people working in other situations where they're exposed to risk, where they're required. And over and above the mandate, and as I say, the general health and safety requirements, both legislative and other regulations, we've got employment agreements, including collective employment agreements that we've negotiated, that have a requirement for all these staff to be vaccinated.
Right.
As I say, even when the mandate goes, we will be having in most workplaces a requirement for people to be vaccinated until we've got better vaccines that completely eliminate COVID or whatever. But so COVID's here now.
Yeah. So you're saying if that mandate came off tomorrow, if the government said it's off tomorrow, all of those teachers who are, nurses, it's a similar conversation sometimes, all of those nurses who are
some similarities, but yeah,
still would not be able to come back to work because there's a legal requirement, a contractual requirement for them to be
in some cases, like I can think we've got an urgent care collective agreement where we put in this well before the mandate. We agreed with that organisation to include a requirement that they be vaccinated. And there are others, there's some hospices and so forth. But so even without that, under health and safety grounds, before there was the mandate, nurses were being vaccinated, and we were advising that they could be vaccinated, and that will remain. Now, obviously, it's helpful to have clear policies, and it's also helpful to have a mandate. We see the problem with masks at the moment. You know, in enclosed public places, people ought to be wearing masks. They should be wearing them in schools by and large, but it's being left to individual responsibility rather than the mandate. Because obviously, the way we're going to deal with COVID is partly essentially a social contract, partly legislation and measures that are promoted as public health measures, and also individual responsibility about people being responsible and being respectful of others. When they're not vaccinated, they're putting others at risk.
Yeah.
And the only way that you can protect vulnerable patients is not to have them there. Simple as that.
Very last question, just back to the original tweet that we started with, the phrase "not wanted" back in the health system, that implies some kind of almost opinion. And I'm wondering, is what you're also saying from your research amongst your members, and of course, you're obviously involved with the health sector, is part of what you're saying that even if the mandate came off tomorrow, even if the mandate came off and nurses weren't required to have the COVID vaccine, that actually the other professionals in the health system don't want those people back in the system because of their attitudes towards, I guess, science in general, based on what they're saying about COVID. Is that what you're actually saying in this tweet?
To a large extent, yes. They're not wanted. They've made a bad call. Obviously, someone can rehabilitate themselves. Someone can say, "I made a mistake.
Yeah,
I made a mistake," and they get a second chance. They get vaccinated and come back. But they're going to be required to be vaccinated, even if or when the health order is removed and people don't have to be vaccinated. It's just prudent precautions, in the same way as in health professionals dealing with people with infectious diseases, respiratory driven infectious diseases have always worn masks. They didn't need regulations to say wear a mask. When someone was coming in, 3 or 4 years ago into a hospital with influenza, they were isolated. If they were coming in with another infectious condition, nurses had masks, they had PPE, they did barrier nursing to protect the patient, to protect themselves, and to protect others. We're just applying that basic, sound, old-fashioned nursing that says don't put patients at risk, reduce the risk to yourself and to others.
The director of the Nurses Society of New Zealand is David Wills. There is the website up in front of you if you want to check it out, nursessociety.org.nz. And as you say, 7,000 members, so that's more than 10% of the nursing population, I guess, is with you guys. David, thank you so much for joining us this evening. We really appreciate your insight.
Thank you for your interest. Cheers.